Health tonight, there's a new study that links the risk of developing a rare condition to COVID-19 vaccines and infections. Here to talk about that is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Good to see you, Doctor.
Hey, Dr. T. Happy Friday. So, question one, it's a rare condition. It's called Bell's palsy. So, what can you tell us about the symptoms?
All right, so Eddie, and I'm going to demonstrate this. Bell's palsy is when you have weakness generally on one side of the face. So patients can have pain in the back of their ear, for example. They can feel a sudden a sensation, sometimes increased sound. But the key is they have a facial droop, like facial paralysis. So I'm going to demonstrate for a second. So you can see I'm smiling on one side. It's the side that you see that I can't smile. So it's the side, and you have difficulty closing your eyes. Okay. What does that look like? When you were looking at that, it can be very scary because it can look like it's a stroke, but it's not a stroke. That's important. And what it is essentially paralysis of the facial nerve. It generally can come on quickly, suddenly, within a day, and usually takes a few days, to evolve. And then it generally improves within the first month, but it can take several months to improve completely. And there's a small percentage of patients that can even have persistent symptoms at about a year. You can drool as well. Again, it can be difficult to close an eye, so you actually have to wear a patch to go to sleep at night, so you don't get too much light sensitivity.
And the reason why we're talking about this is because this is a new study that suggests that people have a higher risk for Bell's palsy after receiving a COVID shot. So how did that risk compare to people who didn't get vaccinated but got infected with COVID instead?
So Maria, really important question. JAMA article, JAMA otolaryngology, which is a fancy name for, basically ear, nose, and throat. They did a study that looked at over 50 million doses of COVID vaccines, and they compared it to people that didn't get the vaccine or got placebo. There was a lot of data in the study, and what they did show that those patients that got the COVID vaccine had an increased risk of the Bell's palsy compared to placebo within about a month. But the more important thing is they showed that actually those patients that got COVID had a markedly increased risk of the Bell's palsy compared to those that got vaccinated. Let me just say it one more time. So essentially, if you're in the general population, your risk of getting a Bell's palsy is about 1 in 5,000. Your risk after getting the COVID vaccine is also about 1 in 5,000. So not necessarily any increased risk beyond the general population, but those who got COVID probably had an increased risk of the Bell's palsy of about 1 in 2,000. So a much higher risk. So the bottom line is still, even though there's an increased risk of Bell's palsy after getting the COVID shot, it's rare, and it's the benefits really outweigh the risks of getting COVID.
All right, Dr. Todd Ellerin, thank you so much. We always appreciate you.
Thanks, Dr. T. Have a great weekend.
Be well, doctor.
We're taking